Clavicle, also called as collar bone. Today we will cover all this points, so watch till end. Introduction. The clavicle is a modified long bone placed horizontally at the root of the neck. It supports the shoulder so that the arm can swing clearly away from the trunk. The clavicle transmits the weight of the limb to the sternum. Side determination. The lateral end is flat and the medial end is large and quadrilateral. The shaft is slightly curved, so that it is convex forwards in its medial 2/3, and concave forwards in its lateral 1/3. Inferior surface has subclavian groove, conoid tubercle, posterolateral. Parts of clavicle: medial sternal end, lateral acromial end and shaft. Peculiarities of the clavicle. It is the only long bone that lies horizontally. It is subcutaneous throughout. It is the first bone to start ossifying. It is the only long bone which ossifies in membrane. There is no medullary cavity. It is the only long bone which has two primary centers of ossification. It is occasionally pierced by the middle supraclavicular nerve. Features of clavicle. Shaft. The shaft is divisible into the lateral 1/3 and the medial 2/3. The lateral 1/3 of the shaft is flattened from above downwards. It has two borders, anterior and posterior. The anterior border is concave forwards. The posterior border is convex backwards. This part of the bone has two surfaces, superior and inferior. The superior surface is subcutaneous. The inferior surface presents an elevation called the conoid tubercle and a ridge called the trapezoid ridge. The medial 2/3 of the shaft is rounded. Is said to have four surfaces. The anterior surface is convex forwards. The posterior surface is smooth. The superior surface is rough in its medial part. The inferior surface has a rough oval impression at the medial end. Muscles, ligaments and joint attachments. A muscle attachments. There are 6 muscle attachment to clavicle. 1. Sternocleidomastoid muscle. Attachment, superior surface of medial 1/3. 2. Pectoralis major muscle. Attachment, anterior surface of medial half. 3. Subclavius muscle. Attachment, subclavian groove on inferior surface. 4. Sternohyoid muscle. Attachment, posterior surface near medial end. 5. Deltoid muscle. Attachment, anterior border of lateral 1/3. 6. Trapezius muscle. Attachment, posterior border of lateral 1/3. There are 3 ligaments attached to clavicle. 1. Costoclavicular ligament. Attachment, inferior surface near sternal end. 2. Coricoclavicular ligament. It has 2 parts. I. Conoid ligament. E. Trapezoid ligament. 3. Interclavicular ligament. Attachment, attached between 2 clavicles at sternal ends. 4. Sternoclavicular ligament. Joint attachments. There are 2 joints attachments to clavicle. 1. Sternoclavicular joint. 2. Acromioclavicular joint. Ossification of clavicle. The clavicle is the first bone in the body to ossify. Except for its medial end, it ossifies in membrane. It ossifies from 2 primary centers and 1 secondary center. The 2 primary centers appear in the shaft between the 5th and 6th weeks of intrauterine life, and fuse about the 45th day. The secondary center for the medial end appears during 15 to 17 years, and fuses with the shaft during 21 to 22 years. Occasionally, there may be a secondary center for the acromial end. 8. Clinical anatomy of clavicle. The clavicle is commonly fractured by falling on the outstretched hand, in direct violence. The most common site of fracture is the junction between the 2 curvatures of the bone, which is the weakest point. The lateral fragment is displaced downwards by the weight of the limb, as trapezius muscle alone is unable to support the weight of upper limb. The clavicles may be congenitally absent, or imperfectly developed in a disease called cleidocranial dysystosis. In this condition, the shoulders droop, and can be approximated anteriorly in front of the chest. Here we have completed all points of clavicle in detail. For more such videos, do like, share and subscribe.